The eye stent inject procedure. Any of these intraoperative gonio lenses can be used to perform the procedure. This prism is an intraoperative gonio lens with a wider field of view. The concave surface rests on the cornea and the flat surface is towards the surgeon to see the angle. This is the eye prism SX that has a self-retaining surface so that minimal support is required for holding. The eye stent injector looks like a pen with a long tip. It has a blue button to retract the sleeve and a black button to implant the device in the Schlemm's canal. Here, under high magnification, we can see the tip of the trocar that is exposed after retracting the sleeve. The stents are seen in the injector. Now we shall demonstrate the surgery for a 65-year-old patient of primary open-angle glaucoma and cataract on medication. The plan was to do a phacoemulsification and eye stent inject. Initial surgical steps and technique is similar to that of phacoemulsification. Here it is being done with phaco-chop and the patient is being implanted with a toric IOL in the back. After that, intracameral pilocarpine is injected and then AC is filled with Helon GV. Before moving forward to the next step, alignment of the patient's head and microscope should be done. Surgeon should be sitting temporally and the patient's head is tilted 35 to 40 degrees away from the surgeon. Microscope is then tilted 35 to 40 degrees towards the surgeon so that the surgeon's eye, microscope and angle of the patient's eye is in one line for easy visibility. You can mark on the microscope for the required tilt and align the marks while rotating. After changing the position as described earlier, the gonio lens is placed over cornea to visualize the angle structure. The injector is then inserted through the main incision. The sleeve is retracted as one reaches close to the angle. The tip of the injector is then used to tent the area of trabecular meshwork with trocar, and then the device is injected by pushing the black button. The trocar and the injector is then withdrawn, keeping the black button pressed. The second stent is placed 2 to 3 clock hours away from the first one in the nasal angle. After implanting eye stent, it can be nudged with trocar to ensure it is well implanted. It is very common to encounter bleeding while implanting the eye stent, which can be washed using irrigation and aspiration while removing viscoelastic, and wounds are hydrated to close the eye. On first post-operative day, one may note a small bleed around the stent area. On first post-op week, patient had 6/6 vision and an IOP of 14 mm of mercury. And this is the angle of the patient demonstrating eye stents in place on gonioscopy.